So today we're going to start with sensory perception, which includes the eyes and the ears at this point. We're going to start with the ears first, and we're starting with mydriatics. The purposes of mydriatics are to facilitate a thorough eye exam, to relieve inflammation associated with uveitis and keratitis, 3, to prevent or break the formation of adhesions between the iris and the lens, and that must be alternated with a miotic to produce that effect, and then 4, to prepare a client for ocular surgery. There are 2 classes of mydriatics, the first being a sympathomimetic. In general, sympathomimetics reduce ocular congestion and redness, and they do this by one of 5 ways. The first is produce a pupillary dilation, 2, increase the outflow of the aqueous humor, 3, vasoconstriction, 4, relax the ciliary muscle, and 5, decrease the formation of the aqueous humor. So you think about that. If you're wanting to relieve or reduce ocular congestion, if you increase the outflow, that decreases the congestion. If you decrease the formation, there's less liquid there, so it reduces the congestion also. You relax that muscle, which is going to facilitate the flow, and then produce dilation and vasoconstriction. So all of those things are going to help reduce the ocular congestion and redness of the eyes. All sympathomimetics must be used cautiously in clients with narrow-angle glaucoma because it can cause an acute glaucoma attack. Sympathomimetics should also be used cautiously in patients with hypertension, hyperthyroidism, diabetes, and heart disease. The first sympathomimetic drug that you need to know about is nafazoline, which is either Clear Eyes or Nafcon. Adverse effects of nafazoline are hypertension, local eye irritation, blurred vision, headache, hyperglycemia, and in children under 6 it can also cause some CNS depression. Nafazoline is contraindicated with MAOI inhibitors and TCAs. If you have a patient that you're giving nafazoline to, you must be diligent about monitoring that blood pressure if they have hypertension, and even if it don't, since it has the potential to cause hypertension. The next sympathomimetic that you need to know about is tetrahydrozoline, and that's Murine Plus or Visine. It has the adverse effects again of hypertension, headache, pyrexia, which is just fever, and rebound conjunctival hyperemia. Again, tetrahydrozoline interacts with MAOI inhibitors and TCAs. Also, it is contraindicated for people who take St. John's wort at the same times. So again, that reminds you about the importance of making sure that you know all over-the-counter medications that patients are taking as well. So when you ask people about medications that they're currently taking, you ask them specifically about prescription drugs, over-the-counter drugs, vitamins, herbal supplements, and then anything that is an illicit drug as well. So also with tetrahydrozoline, you must monitor the blood pressure, and because it has the potential to have an adverse effect of pyrexia, you must also monitor the temperature. The next classification of mydriatics is anticholinergic, and they produce pupillary dilation and can interfere with the ability to focus properly, which is psychoplegia. Anticholinergics are useful in relieving inflammation associated with uveitis and keratitis. Long-term use, though, does cause systemic effects such as blurred vision, dry mouth, fever, and urinary retention. Anticholinergics can cause increased intraocular pressure, so you do not use in patients that already have been diagnosed with glaucoma. The example of the anticholinergic that I want you to be aware of is atropine sulfate. Atropine sulfate comes in a solution or an ointment. Adverse effects include acute angle closure glaucoma, blurred vision, and decreased visual acuity. Patients on atropine sulfate should use dark glasses to decrease photophobia discomfort. Atropine sulfate should be cautiously used in patients that have Down syndrome or in pediatric patients in general. So you need to know the specifics about the drugs I have mentioned. and you need to know how they operate. Remember, sympathomimetics reduce ocular congestion and redness. Anticholinergics produce pupillary dilation and can interfere with the ability to focus. And then know about the drugs. The next set of ocular drugs that we're going to talk about are antimicrobials. Antimicrobials include bacterial, fungal, and viral medications. Anything that's used to treat either a bacterial infection, a fungal infection, or a viral infection. Conjunctivitis is the most common non-traumatic infection that there is of the eye, and that's simply pink eye. It's that inflammation of the conjunctiva. Viral etiologies are much more common than bacterial, though, and the most common drug class that treats bacterial conjunctivitis is the fluoroquinolones. Antibacterial agents are used to treat the superficial infections by microorganisms. You have to be careful to monitor for hypersensitivity because people always have adverse reactions to antibiotics, and that doesn't change just because it's administered via the eye and not PO or IM or anything like that. So you have to monitor for hypersensitivity. Systemic therapy should accompany ophthalmic therapy. And people who wear contact lenses should not wear their contact lenses during ophthalmic therapy. And new lenses should be used after the completion of therapy. If these people were wearing their contact lenses when they acquired whatever the infection is that they have, be it bacterial, fungal, or viral, they should not wear those contact lenses again. They should throw them away and start with a fresh pair of contacts after their therapy has ended. Ciprofloxacin is a fluoroquinolone that comes in a solution and an ointment that's used as an antibacterial agent to treat those superficial infections. It's a good drug of choice because it has a broad spectrum for gram-positive and gram-negative bacteria. Some of the adverse reactions, though, for ciprofloxacin is bad taste after installation, local burning, itching, and foreign body sensation. Fluoroquinolones have the potential, though, to increase the effects of warfarin. So if you have a patient who's on warfarin or Coumadin, then you need to monitor that it's not affecting their PT-INR when they use a fluoroquinolone as well. It may be recommended by the physician that they stop therapy, Coumadin or warfarin therapy, while they're on the ciprofloxacin. It just depends. But you have to be diligent about that and make sure you're monitoring for those effects while they are on the ciprofloxacin. The next antibacterial agent that we need to talk about is gentamicin. It is an aminoglycoside. It comes again in a solution or an ointment. It has the adverse reactions of local burning and irritation, hallucinations, and thrombocytopenia purpura. You probably need to look that up if you do not know what it is. Thrombocytopenia purpura. The next drug that we want to talk about is an antifungal. There didn't used to be very many antifungal drugs, but there are now a couple that we can use, the most popular being natamycin. If there is no improvement in 7 to 10 days with the use of an antifungal, you have to assume that it's not susceptible to the natamycin, which means that you are probably not looking at a fungus. You're probably looking at something viral or bacterial. So just be aware of that. If the patient shows no improvement in 7 to 10 days, make sure that you make sure the physician is aware of that so the drug can be changed. Now, natamycin comes in a suspension, so it must be shaken before it's used. It has adverse reactions that include changes in vision, dyspnea, chest pain, tearing, and paresthesia. PEDS dosing is currently not available for natamycin, so that's very important to remember. The next drug is the drug class is an antiviral. Viral infections of the eye can be painful if not treated, and they can lead to retinal scarring and loss of vision. The antiviral that you need to be aware of is ganciclovir. It is a solution, and it has the potential side effects of blurred vision, eye irritation, and conjunctival hyperemia. So those are the anti-infectives that you should be aware of for the eyes. Okay, the next thing that we need to talk about are antiseptics. Antiseptic use has declined. It is still used sometimes as an ocular irrigant. An example of that is boric acid. Silver nitrate solutions are used to precipitate and remove accumulated mucus from the eyes. And that's about all you should really know about antiseptics. You just, again, need to make sure that you're aware of allergies and then be monitoring for hypersensitivity reactions to anything. The next thing is ocular irrigation. Ocular irrigation is used to flush out chemicals, blood spatter, or small particles. The most common ocular irrigant is normal saline because it's so close to normal tears, natural tears. You should take caution not to use excessive pressure, though, when you are irrigating, because you could damage ocular structures. Next, we have local anesthetics. They're used to numb the eye for removal of foreign objects or stitches from the cornea. Or other short-duration surgical procedures. Local anesthetics temporarily eliminate the blinking reflex, so you have to take great care to protect the eye during the procedure. Proparacaine is the most common anesthetic. It can cause some irritation and stinging. A serious reaction to it is seizures and CNS depression. Lidocaine is also used sometimes, and some of the side effects of lidocaine are headache and burning. And again, because it is a numbing agent, you have to make sure to take care to protect the eye during its use. With prolonged use of local anesthetics, there is the potential for corneal ulceration and possible vision loss. Eye patches have to be worn over the affected eye after the use of local anesthetics so that the eye is protected when there is no blink reflex. Corticosteroids are the next thing that we need to talk about. They are anti-inflammatories. They're used to relieve pain and discomfort. They may also inhibit scar formation. Corticosteroids are contraindicated in fungal and viral infections because they cause the infection to spread. Corticosteroids should be used for short-term use only, and the eyes should be examined frequently and monitored for intraocular pressure. Difluprednate is the newest corticosteroid. It's used after eye surgeries. Again, contraindicated with bacterial, fungal, and viral eye infections. Has no systemic effect, but some of the side effects include increased intraocular pressure, headache, and blurred vision. NSAIDs are next. NSAIDs are used to reduce the edema and inflammation after ocular surgery and other ocular inflammations. Diclofenac sodium Voltaren is used after cataract surgery. It's contraindicated with contact lenses. It must be monitored for hypersensitivity reactions if previous reactions to aspirin or other NSAIDs has occurred. PEDS dosing is currently unavailable for diclofenac. Diclofenac is also contraindicated in third semester pregnancy or in breastfeeding. The next NSAID that we want to talk about is cyclosporine, which is Restasis. It's used for chronic dry eye if there's decreased tear production. That's common in the elderly. There is very minimal to no systemic absorption, and the side effects of Restasis include blurred vision and foreign body sensation. Antihistamines are next, and they're used to treat conjunctivitis associated with allergies. An example of this is epinestine or Elestat. It's a dual-action antihistamine with minimal systemic absorption, and the side effects of it are URI, cough, rhinitis, and pharyngitis.